Okay.
All right. We're live?
Yes.
All right. I'd like to welcome everyone to the Thursday, September 14th, 2023 meeting of the Delaware County Board of Commissioners. Would you please rise and join me in the pledge? I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, thank you. I'm Jeff Benton, President of the Board this year. To my left is Vice President, fellow Commissioner Gary Merrill. To my right is our fellow Commissioner Barb Lewis, our Administrator Tracy Davies, our Deputy Administrators Don Houston, Eric Hostetler, and our clerks today, Jennifer Walraven and Allie Glusich. We can begin.
Resolution number 23-788, in the matter of approving electronic record of proceedings from regular meeting held September 11th, 2023.
So moved.
Second.
Discussion, vote.
Vote on motion 23-788. Mrs. Lewis?
Aye.
Mr. Merrill?
Aye.
Mr. Benton?
Aye.
We do not have any public comment today. That brings us to item number 3, resolution number 23-789, in the matter of approving purchase orders and announced certificates and payments of warrants in batch number CM APR 0913.
So moved.
Second.
Discussion, vote.
Vote on motion 23-789. Mr. Merrill?
Aye.
Mrs. Lewis?
Aye.
Mr. Benton?
Aye.
For item number 4, Director Jeff Fischel of Emergency Medical Services has some presentations.
Morning, Commissioners. Jeff Fischel, Director of Delaware County EMS. With me in the room is Dr. Panchel, Medical Director, Assistant Chief Rachel Cox, Anna Smith, and we have John Raines, Chase Moore, and from Medic One today, and Captains Joe Farmer and Captain Jude James. And we are here to present 2 awards to the commissioners on behalf of Delaware County EMS. The first award I'm going to talk about is the Mission Lifeline Award. If you might recall from previous years, we bring the Mission Lifeline Award to the commissioners' session and talk about it. We have been fortunate enough to get Mission Lifeline Gold Plus for numerous years at this time. They changed the wording of it a little bit this year, and so now we are gold with Target Heart Attack Honor Roll. So we had to look up what that meant a little bit. We needed some feedback from the American Heart Association because this was actually awarded to us about a month ago. And what it essentially means is that we hit gold, meaning we hit and exceeded all of the benchmarks that the Mission Lifeline lays out for stroke and cardiac care. But when they say that you're on the Heart Attack Honor Roll, that means that you have shown that you excel as an EMS system in your treatment and transport of patients who are actually having a heart attack or a STEMI. So this is the highest award that Mission Lifeline or the American Heart Association issues out to EMS services, and through the hard work and dedication of the field staff, the CQI staff, the training staff, everybody in the office, it takes a team. We were able to achieve the highest recognition this year. So that's the Mission Lifeline Award. Before I move on to the next one, is there any questions about the Mission Lifeline and what it means?
I don't think I have any questions.
No, congratulations.
Yeah.
I know it's a big award to get year after year.
Dr. Panchel, do you have any comments on that? He actually sits on the AHA board and has a little bit more insight on this sort of stuff than I would. Putting you on the spot, essentially, is what's happening.
Hello, everybody. How are you all doing today? So just to give you my background, so I am actually chair for science for the American Heart Association. And so I've been in that role for the last 2 years and worked as a volunteer for the American Heart Association for the last 13. So one of the big things about the Mission Lifeline program is that it identifies and actually confirms competency. So, so you actually have to give the proof that you are actually doing this level of care such that you can actually win these awards. And so it's an amazing honor for us in the sense that we're consistently providing the data and we're consistently achieving and going above for our county. And I think it comes back to what our mission is, right? Being committed to the community. And these kind of things evidence that excitement that we have in our program to really move forward and do great care. So thanks.
What he said. So essentially, this is a commitment to our community that you will get the highest level of cardiac care when a Delaware County ambulance comes, picks you up, and treats you and transport you to the hospital. Second, I want to speak about the Hooley Award, which is a new thing for us. They've been going on, it seems like they've been going on for about 15 years. Hooley Awards are a national award put on by Image Trend, bless you, put on by Image Trend. And essentially what you do is you produce the Image Trend with documentation, speaking about the service a little bit, and with everything that they looked at, all of the documentation, they provided a really nice write-up on our service. It's way too long for me to read here. There was a nice video played at the awards ceremony. We did not win the final award. We were one of the finalists, and we got a little glass sphere that was brought home. But we did go to Minnesota and sit at the conference and sit at the awards ceremony and were recognized. But I do want to touch on two of the paragraphs out of this write-up, just to give an understanding of what the reason was behind our being recognized. It says Delaware County EMS, a leading third service EMS agency in Ohio, has emerged as a beacon of innovation in the rapidly growing region north of Columbus. Known for their commitment to excellence and dedication to providing the highest quality pre-hospital emergency care, DC EMS has been at the forefront of implementing responsible, evidence-based practices that meet the evolving needs of their community. Delaware County EMS exemplifies excellence and innovation in the field of emergency medical services. Their unwavering commitment to quality care, continuous improvement, and collaboration with partners like the Delaware County Sheriff's Office sets them apart as trailblazers in the industry. As they strive to meet the ever-evolving needs of their community, DC EMS remains a shining example of what can be achieved when dedication, innovation, and a passion for service converge. So that's kind of the, it goes on to explain all that in detail in further paragraphs, but I'll give you a copy of it. I won't read it here today. Nonetheless, I want to recognize the crews that are out there on the street. I want to recognize the individuals who work in the office, the medical director, the dispatchers, our partners. It's obviously a team effort. There's no one piece of any EMS system that works without the rest of the team. So congratulations to Delaware County EMS, congratulations to the team, and I'm proud to present these awards to you.
Great.
Does anybody else want to speak?
You had a couple late entries. Did you want to
Yeah.
introduce them?
Lieutenant Mike Resendez and Walt Schischler from Medic 4.
Great, welcome.
Welcome.
Well, congratulations, Jeff.
Yes.
Both these awards are very, I'm sure, very well deserved, not easy to get, and congratulations. And I know it does take a team.
Yeah, my comment is, I think Delaware County residents really, if EMS does its job, it's kind of like nobody knows you're there and you get the job done, and I think we do a fantastic job. But the whole EMS system in our county works well for the benefit of the residents, and just a compliment to Delaware County certainly, and all the others that are involved as well, and in tandem with 911, and I think our residents really are taken well care of, and And I think we need to work on how we communicate and convey that message to our residents, because I do think it gets taken for granted, and we need to find creative ways to make sure they know about these awards and what's going on. So just my observation.
Great.
Well, and I think with really everything you do, time is of the essence, and I'm just thinking heart attack, oh my gosh. I mean, it just takes a tremendous amount of dedication and readiness to win these awards. So congratulations, and again, our citizens are being well served, very well served.
Yeah, it's great to see, Jeff, and again, the whole team. I know you got just a few of them here compared to all the rest of the folks who were at the various stations, but again, thank you all for what you do. One other award I did want to just mention again as well is the Mark Angelos Emergency Medicine Researcher of the Year. Our very own Dr. Panchel received that this year, just recently. So while you're here, thought we would publicly acknowledge your contribution, because a lot of what we're doing is because of your leadership, and Jeff and the team embrace it, but it's great to see the efforts paying off, and recognition is good. It shows we're doing what we should be doing. So congratulations to you. Jeff, did you want to get some pictures? Do you have
Yes,
plaques
please.
or anything?
I got
associated?
a certificate from the American Heart Association, and the Julio Award is a small cube that will probably shine light back when you try to take a photo. So we can take one with this.
All right.
All right.
I feel bad, I forgot about Dr. Panchel. So I feel bad I didn't mention Dr. Panchel.
All right. Thanks, everybody. Good work. Jennifer, we can keep
All
going?
right, that brings us to item number 5, resolution number 23-790, in the matter of approving an amendment to the use of a procurement card for the Emergency Communications Department.
So moved.
Second.
Discussion.
Good morning, Commissioners. Justin Navi, Director of Finance. This request has been submitted just to amend the daily spend limit on a P card for an employee in 911. They're going to be attending a conference in November, and the lodging fees are pretty expensive, so they just need the daily limit increased.
Okay. Vote, please.
Vote on motion 23-790. Mr. Benton?
Aye.
Mr. Merrill?
Aye.
Mrs. Lewis?
Aye.
Resolution number 23-791, in the matter of approving the use of a procurement card for the Economic Development Department.
So moved.
Second.
Discussion.
Thanks, Commissioners. This is just a P card request for a new employee in the Economic Development Department.
Okay. Vote, please.
Vote on motion 23-791. Mrs. Lewis?
Aye.
Mr. Benton?
Aye.
Mr. Merrill?
Aye.
Great, thank you.
Thanks, Justin.
Thank you.
Resolution number 23-792, in the matter of ranking the proposals submitted for the Delaware County Video Production Services.
So moved.
Second.
Discussion.
Good morning, Commissioners. Jane Hawes, Director of Communications. We recently completed the review and analysis of the 5 proposals that we received in response to the RFP that we put out for video production services. And in completing the ranking, the committee found ranked Outsider Video plus Motion Graphics as the top candidate, really by a considerable amount, as opposed to the other four. So we recommend approving these findings and then proceeding to conduct the contract negotiations with Outsider. They are the firm that we've worked with for the last 3 years. And they're very familiar, obviously, with the county. And the quality of their work, though, stood out, not just the work that they do for us, but for other clients. So I don't know if you have any questions.
No? Okay. Vote, Jennifer?
Vote on motion 23-792. Mr. Benton?
Aye.
Mrs. Lewis?
Aye.
Mr. Merrill?
Aye.
Thank you.
Thank you.
Thank you.
Resolution number 23-793, in the matter of selecting the most qualified construction managers at risk for the North Star Water Reclamation Facility NPDES Plant Upgrades Project for Delaware County, Ohio.
So moved.
Second?
Discussion.
Morning, Commissioners. Eric McPeak, Deputy Director of Operations for the Sewer District. This is the second step in the proposal process. We put out a request for qualifications for construction manager at risk firms, and we received one applicant. And that we've determined that they're qualified. We've worked with them before. So now this is to issue them an RFP to look at scoping and price proposals from them. This is a project at North Star to take it from a land application permit to a beneficial reuse. We'll continue to water the golf course, but also direct discharge to a stream. It's beneficial for us and the developer, and they're participating in funding the project. So far, they're paying for 3/4 of the engineering fees, and it'll be a similar split. It's scope dependent, and we need to wait till costs come in. But that's how the project will be supported.
Similar being the same split?
It'll be very similar, yeah.
Okay. Only one bid, though.
Yeah, we're seeing that a lot right now. We had some interest, and some firms reached out to let us know they weren't going to be going after this just because of the rest of the workload and everything else. It's a hard time to get good qualified contractors. Like I said, we've used this firm before, so we'll see what their pricing comes back as. So
Right. What's the timeline on this project, then?
we would like to break ground on it, so to speak. If we can get them under contract soon, we can order the long lead time equipment, but we'd like to start building in January or February and be done by the end of '24. It's a little aggressive on the timeline, but if we can get the equipment, I think it can happen.
Okay. Other questions, comments? Vote, please.
Vote on motion 23-793. Mr. Merrill?
Aye.
Mr. Benton?
Aye.
Mrs. Lewis?
Aye.
Thanks.
Thank you.
Thanks, Eric.
Resolution number 23-794, in the matter of approving the 2024 Group Health, Dental, and Vision Insurance Renewal with the County Employee Benefits Consortium of Ohio.
So moved?
Second.
Discussion.
Good morning, Commissioners. Dawn Houston, Deputy Administrator. And with your approval of this resolution, we would be accepting the renewal with SEBCO for calendar year 2024 for the county's health insurance, prescription drug coverage, and dental and vision coverage for our employees. Our dental and vision plan designs will remain the same, as well as our health and prescription drug coverage for 2024. Our rates are locked in for 2024 for vision and dental. However, we did receive an 8% increase toward the cost of our health insurance and prescription drug coverage for 2024. This resolution basically just recognizes that we will remain with the same plan designs, and over the next few weeks, we'll be working on determining what the employee-employer cost share will be for health insurance as well as the prescription drug coverage. So if you have any questions, I'd be happy to answer them.
You've done a nice job of keeping us posted and engaged during this process, and it's very important. It's very expensive. It's a big dollar commitment for the county, but very important. So
Yeah, the only thing I would add is SEPCO's been a good partner for a long time, and we're fortunate enough to have Commissioner Benton serving on that board to make sure that our interests are protected. And I think we've all been well served by SEPCO, and just see no reason not to support the continuation of that relationship. And unfortunately, insurance, medical is expensive. Inflation's not making it any better. And we all would like it to be less, but 8% in this environment is probably not unreasonable.
Yeah.
And I certainly support this.
Yeah, of the 40-some counties that were that participate with SEPCO, we were about in the middle of the pack. I mean, there were some with 0, and there were a bunch with 13%, which was the maximum, so, again,
Well, the quality of the insurance is excellent.
yeah.
So also too, the plan design, keeping the plan design the same will also help our employees with continuity. And so they can count on this excellent plan being continued, and it
Yep.
really is. It's fabulous.
All right, let's take a vote.
Vote on motion 23-794. Mrs. Lewis?
Aye.
Mr. Merrill?
Aye.
Mr. Benton?
Aye.
That brings us to administrator reports.
Morning, Commissioners. Tracy Davies, County Administrator. Just attended DCFA last night. Commissioner Benton was there as well. Nothing major really to report out of that meeting. Also, just a note that the county fair starts, and we will have session Monday at the county fair, so looking forward to that.
That's right.
That's all I have.
I don't have
Anything?
anything. Thank you.
Eric, anything? Okay, Commissioner Merrill?
Well, Tracy stole my thunder. The only thing I had down I was going to mention was the fair next week. And it's a long tradition that we have the first Monday of the fair out there. And I know we look forward to a very successful fair this year and changes at the grandstands. And I think it's going to be exciting, and the $1 million purse. And looking forward to a very successful week for the county fair.
Yeah, it'll be very busy, for sure. Commissioner Lewis, anything?
Yes, I attended our Families and Children First meeting yesterday. The coordinator for that is Rachel Lane, and she has done an excellent job over the years. The services to the community have increased, and it was under the leadership too of our JFS director, Bob Anderson. And so they have issued an annual report, and which we'll send to all the commissioners. But they have served 114 youth, and 104 that includes the families. Then that it doesn't. The 114 youth are part of a family. So the impact to families is a lot larger even than the 114. But Rachel's done a great job of reaching out and coordinating with several of the different bodies that also work together on Families and Children First, developmental disabilities, mental health board. So it's a good report, and most importantly, a lot of progress has been made, and that's it.
Okay. Great. Just a couple other things. Again, the Finance Authority meeting last night was very interesting. There is a lot going on. They've had a lot of successes and are involved in a lot of projects and moving things along to benefit Delaware County and the commercial area in particular. And then we do have lots of activities at the fair next week. The jug is Thursday, as we all know, and the purse is $1 million, as Commissioner Merrill mentioned, which is the highest ever and one of the highest, probably the second highest in the country for a harness race. And so we're expecting a really good field. And then we've got the grandstand renovation is supposed to be done, and we can go in and use the much improved facilities. Next year, this year is kind of the first floor. Next year is going to be the grandstand, or the seating area of the grandstand. And then they've got plans for other, they've improved one barn already, renovated one barn. They're going to do some more of that. Work on a covered riding arena is kind of in the next lineup, next round of improvements. So anyway, a lot going on out there. It's always fun. So hope everyone gets to enjoy the fair.
I thought of one more thing.
Yes.
And Director Anderson mentioned, and I didn't know about this because it just happened with the state budget, but the governor's initiative for a new state department, which is called the Ohio Department of Children and Youth, was part of the budget. And therefore, work is happening now on organizing this. It will affect our Jobs and Family Services, and a lot of our services across the board dealing with JFS, Families and Children First. And so I have asked Director Anderson, when he comes to session next time, to just report on the progress of this. And this is a long-standing desire of the governor to improve services to both.
For
to
kids in
both
particular.
kids, right,
Yeah.
right, yeah. And so, so it's really kudos to him for doing it. And now it's the implementation. So he'll report to us when he's here.
Okay, great. Jennifer, I think we're ready for executive session.
Resolution number 23-795, in the matter of adjourning into executive session for consideration of promotion and compensation of a public employee, for collective bargaining, and for matters required to be kept confidential by federal law or regulations or state statutes.
So moved.
Second.
Discussion? Vote?
Vote on motion 23-795. Mrs. Lewis?
Aye.
Mr. Merrill?
Aye.
Mr. Benton?
Aye. All right, we're now in executive session.